Councilmember Carrasco, visually on the screen. I'm not sure if it could be heard verbally. Yeah, she is there.
There she is.
Yep, there she is.
Okay, so I'm
And-
marking present for Carrasco.
Okay, and Tony, do you have any?
Arenas and Foley.
Okay. I'm hearing a here from the TV.
And Foley.
Okay, so that was Councilmember Arenas who said here. I'm
And-
presuming, because her name was,
That was Pam Foley, she said.
that was Pam Foley. Okay,
Okay, everybody's present. Thank you guys for the patience.
okay. Let's rise for the Pledge of Allegiance. Thank you. For our invocation today, we'll try a variation of the old theme. Typically, we invite members of our community in, and I know under this, the current emergency, we're going to try to do things a little differently. Councilmember Perales will read a poem in lieu of an invocation.
Thank you very much, Mayor. We had a couple invocations scheduled for the duration of this month that it did not get completed, and so at the advice of Councilmember Davis, the idea rose on maybe giving a poem myself, and this poem actually was provided by her, and it's a poem by Laura Kelly Fanucci. And it's very telling for our time. Some of you may have seen it. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hoped to be. And may we stay that way, better for each other because of the worst. Thank you.
Thank you, Councilmember. Those are words I hope we'll hear again soon. Okay, for orders of the day, I'd like to ask if anyone in the council has any changes to the printed agenda. I'd like to make one change, which is the 3.4, which was scheduled to be dropped. I just wanted to ask for us to hear that relating to the memorandum that I recently submitted. Vice Mayor Jones would like to pull item 2.19. I think that's from consent, is that right? That's okay, we'll move on to that in just a moment. Item 2.12, Hanson Bridget amendment. The city attorney will defer that to the April 21st council meeting. Item 2.2 is amended. Relating to the incorporation of current and future governor's executive orders regarding the Brown Act and City Open Government Sunshine Resolution. That would be added under orders of the day by a 2/3 vote, so we must approve this by at least 2/3 for that to be approved. Are there any other changes?
Mayor, I know it's, item 2.22 is the one that needs to be added to the Brown Act, the current future governor's executive order, Brown
That
Act
is,
reading.
Yeah, that needs to be added by 2/3 vote.
I'm okay with adding it. Is there any way I can ask a question on it?
Yeah,
do I
why
need
don't
to
we
pull it after I
consider
add
that
it?
under consent?
Right, so this item's going to be, you're just voting to put it on so you can discuss it. If it's not voted on, you can't discuss this aspect of
So
it.
then we can
Okay.
get to it under consent.
Okay, thank you.
Okay. Any other questions? No. Okay. Let's vote first on orders of the day.
I'll
Tony?
move the orders as described.
Oh, thank you.
Who was the second on that?
Me.
Thank you.
Thank you for
Okay.
the
I think I
motion.
beat you. I'll let you have this
We
one.
give it to Jones.
Mayor
Okay.
LaCarla.
Vice Mayor, all right. Got it.
Mayor
Okay,
LaCarla.
Yes.
Jennifer McGuire over here.
We need, the administration also recommends to drop 2.16 and 4.1, just taking a pause here while we're evaluating our fiscal situation related to the COVID virus.
Okay, I'll ask the maker of the motion, Councilmember Perales, that's acceptable?
So dropping 2.16, the amendment to the master agreement with CPS HR Consulting, and then what was the other one?
The other one is the Police Department Sexual Assaults Work Plan.
4.1.
It's a 4.1, it's the use of the reserve right now while we're evaluating our fiscal situation.
Exciting.
Things
some
got
feedback going on.
psychedelic there.
Got some feedback. Yes, I will incorporate those two into the motion for orders of the day.
Well, this is going to be fun, isn't it? Councilmember Esparza.
Thank you, Mayor. Yes, I have a question about 4.1. Do I ask it now, since we're dropping it under the orders of the day?
Yeah, if you'd like to speak on that issue about whether it's dropped, sure.
Yes, thank you. Jennifer, I guess this is a question for you in terms of when this item will be back.
So right now, the Budget Office is assessing our fiscal situation, which was, discussed obviously last week, that it's expected to be severe. And so we will be bringing back a discussion of our fiscal situation planned for April 7th. And so hopefully, based on some principles of how we're moving forward, we can bring this back one way or the other within a month or so. I think would be a time frame I'd like to look at. But we need to assess, how bad this fiscal situation, what are our options to help close some expected severe gaps, and making sure we understand all the trade-off questions. This is a very high priority item for the administration and for the police department, especially given the nature of the subject matter and the orders that we're under right now, so we understand. So we want to make sure that the use of that money is in the highest, best use possible for our community at this juncture. And we need just a pause here to look at the use and see what we recommend to bring forward. So I'd say, we'd like probably a month, bring it back in April sometime to have that space to understand that in our fiscal situation as well.
Okay, so the end of April, this could come back so that we can move forward. I appreciate all your hard work on this. One of the concerns that we brought up last week was, given the shelter in place, what this means for child abuse, sexual abuse, and domestic violence. And so, unfortunately, those are realities moving forward. So thank you for staying on top of this, and I'll go ahead and support that, just knowing that it will be back in April.
And I just want to assure the council that the money is still in reserve for this purpose. There's no other action being taken to redirect it to anything or to change that manner of the use at this point.
Thank you.
And Councilmember Esparza, I'm happy to discuss with the city manager how we could have a discussion, particularly on that issue, sexual abuse, child abuse, and domestic violence in light of our new reality. Wow. And we come back in a future week prior to the time when we have that discussion about the whole plan, because I understand that is a particularly unique concern as we're experiencing the current crisis. Dave, you had another item.
Yeah, also, we were going to request deferral of item 5.1 as well. That's the airport master plan item.
We're still on orders of the day, right?
Right.
Yeah, we're still
Yes.
on,
Yeah.
I'm comfortable with that as well.
Okay. And that's all right with the seconder?
Yes.
All right, and for the members of the public who may be puzzled by all these changes, right now we've got a very busy, underslept, overworked city staff right now is focused entirely on this crisis that we're confronting now, and they're doing an excellent job around a whole host of issues around continuing provision of services, as well as now taking on new responsibilities such as the distribution of food countywide. So everyone is very focused on that. We don't want to pull them into the council for these hearings until and unless the items are particularly urgent. And so these calendars will be a bit thin for a while until we're able to get the bandwidth we need to be able to engage more meaningfully. All right, on the motion, any other comments? All right, Tony, let's vote.
Okay, I'm going to ask everybody to unmute if they're remote. Jimenez,
Yes.
Peralez,
Yes.
Dieppe,
He's nodding his head, but we can't quite
okay,
hear him.
good, I can't see the screen when I'm looking down.
Yeah.
Davis? I'm going to move on to Esparza.
Yes.
Arenas? Foley? Camus?
Yes.
Crosco? Jones?
Yes.
Liccardo?
Yes. Do we want to try to run through the other?
Yes, I'm going to do that again.
Okay.
And if they can't audio, maybe they could text me and I can say it out loud.
All right.
I've got my phone in front of me.
So,
Davis? Arenas? Foley? Crosco?
to all those council members online, I see Lund is clearly holding up a sign.
Lost audio is what
Audio is lost.
Okay, so okay.
Yep.
I'm
Councilmember
gonna
Dieppe, who
text
appears to be in
them.
captivity. He's got the, there you go, okay. He's now holding up another sign. Let's see if we can focus on that.
I can't see it.
Zoom people want to talk. They want to talk. Maybe
Yes,
on
Councilmember Crosco would like to be heard
probably on orders of the day.
on orders of the day. And I see her hand up.
Yes.
We're simply not able to hear her. So I'm going to ask Councilmember Crosco, could you please text something to
Okay,
Tony?
Henry's getting their audio, by the way.
They're getting their audio that we can't hear them.
Right.
Okay.
So guys, did you hear that? Henry's getting their audio.
Seems to be what Councilmember Crosco is saying.
I just created a group text for everybody who's doing remote, so they can text me.
Maybe a mic.
Okay, then I'm assuming Brown Act would require you to tell us what their text says. Is that right?
Yes.
Grab that mic.
Any information that you get during the hearing that's in response to a comment has to be made a public.
Before we go to the text, maybe we sort of break for an ability to get the
Yeah,
audio back up.
And I
think
will say, if
probably
they
easier.
text me, I will read it out loud.
Okay.
We're
Did
gonna
Councilmember
try putting the
Crosco,
microphone up to Henry's laptop.
Tony, did any of the council members? Tony, did any of the council members indicate they'd like to speak?
Wait, what? Sorry.
I'm sorry, I need your attention, Tony. We've just
Sorry.
got to focus on this. Did
Yeah.
any of the council members indicate to you that they'd like to speak?
Not yet, but
Okay.
Kevin just told me that the council chambers can hear them, so I'm letting them know that, and I'm asking them to text me if they want to speak.
Councilmember Carrasco did, I believe. Had her hand raised.
No, but he can see her.
Sylvia also indicated she'd like to speak.
We're all in a group text.
Okay.
Glad we're getting this worked out before 2 weeks.
Yes. So you're not going to do the microphone thing? Try, yeah.
Hello to everyone in the chamber.
Hello, Councilmember Carrasco, we can hear you.
Oh, thank you so much. I was actually advocating for Councilmember Arenas. Councilmember Arenas.
Okay, Councilmember Arenas would like to speak. Can we hear her?
I just sent Tony a text. I almost regret raising my hand, but I'm glad that I did because then that kind of helps us troubleshoot this audio issue that we're having. So I just wanted to reiterate what Councilmember Esparza brought up about making sure that sexual assault and domestic violence and any of those crimes that sometimes get augmented during crisis, and I can almost put money on seeing a rise of numbers, especially around child abuse, since parents or caregivers will have more time spent with them and uninterrupted time and no respite. And so I want to make sure that these issues continue to be in the forefront. I appreciate Jennifer, your support with this, and I know that when it comes back, it'll be a good recommendation in terms of use of our resources. So thank you.
Thank you. All right. We are past orders of the day.
Shall we get their audio vote?
Did we actually get their audio vote, Tony?
We
Yeah.
never did.
I can hear you.
And it's caps lock W.
What are we on? Are we on consent?
Oh, I misspoke.
Okay, and we're trying to relog.
Council members are gonna reevaluate the Zoom setup in the wing room. Oh,
Not your name,
I see,
the
I see.
meeting
All
number.
right. Just give us 1 second.
Okay, thanks. Thank you. Okay, call you back in a sec.
Do we now have a vote?
Yeah, can they hear me to vote? Are you guys getting audio? The remote people? Davis?
Oh, do you want me to turn the
Yeah,
volume?
you need to put the
Yeah.
mic back.
So we're voting on orders of the day. I still need to hear from Davis.
Could be fun.
Was that yes?
Should have brushed my hair.
As-
They're able to hear you guys.
Okay.
Okay, so orders of the day vote.
They're able to hear
Davis?
you on the
Where's
vote.
Sylvia now?
Davis, are you voting yes?
Councilmember Davis?
Yes.
Thank you. Arenas?
Yeah. Councilmember Arenas?
She's gone.
Foley?
She's back now.
Crosco?
Councilmember
I'm
Crosby?
here.
I'd
Okay,
ask all council members, when they're all asked to vote, if, after you've done so, could please text your response also to Tony, who will then read your vote from the text. So we'll be able to move along a little more quickly,
Yes.
given our technical challenges. Okay, I understand there's some folks who are not able to reach, but given the perfectory nature of this vote, I'm going to move on.
Yes.
We're on to the closed session report. That should be a brief one.
There was no closed session today, so there's no report.
Thank you, Ed. All right, on the consent calendar. Now, Vice Mayor Jones would like to pull item 2.19 relating to local streets. Are there other items to pull from consent? Councilor Esparza?
Mayor, I'd like to pull 2.22.
2.22 for Councilor Esparza. Other items? All right, we'll entertain a motion on the remainder.
So moved. Second.
Motion the Vice Mayor.
Can you guys hear anything?
Nope.
Okay, so we just heard they're not getting any audio remotely.
Okay.
Jones was the mover. Who was the seconder? Thank you.
So again,
Voting on consent.
let me, if I can, I'd just like to consult with the city attorney.
We have 6 present. We have a quorum.
Right.
It'd be easier to be full virtual. We wouldn't have this issue.
Yeah.
Pam, use the restroom.
So if I were to text them and make a record of
They're able to hear, and I can hear everything they're saying
Okay.
through my computer. I think
So Tony, what I think I'd like to do, I understand they're having problems hearing us right now. We're
Yes.
hoping that will be restored soon.
We can hear you now. We can hear you now.
Okay, that's great news. Given all the challenges we're having, I'm going to create a text string right now that's going to include all of the council members who are relying on on audio and video, as well as Tony. And keep me honest, I'm happy to include anyone else. Would be the city attorney? No. City clerk is fine. Okay. So that way, anytime anyone would like to speak, if you are not sensing that I am recognizing you in a timely way, if you can please text so that we will immediately be notified. Okay, and just to be clear, that's council members Foley, Arenas, Carrasco, and Dieppe and Davis. Okay. Okay, so I'll keep watch on that, and Tony will watch as well.
Yes.
And we'll give this a shot. And if at any point people cannot even hear us, then also please notify us by text, and that way we'll all know. All right. We're on the consent calendar. There was a motion on the items that were remaining, that is, all the items except for 219 and 222. Given the challenges of voting, I'd like to first just take on 219, Vice Mayor.
Okay, I had a conversation with John Risto about item 219, and my question to him was about the outreach and efforts that they're making to bring small and local businesses into the contracting process. That's going to be especially important now that we're going to go into an economic downturn, and those small businesses are going to look to the city to be a lifeline in terms of having work to do and earning an income. And John actually walked me through a detailed presentation that he was going to give on March 17th, and I thought it would be valuable for the whole council to see the presentation. It's a short presentation, but I think there's a lot of value in everybody seeing it.
Okay. John?
There we go. Thank you. Good afternoon, John Russo, Director of Transportation. Yes, we do have a PowerPoint. I'm not sure if it's loaded or not. If it's not, I could certainly just walk through some of the questions that.
Why don't you
Vice
walk
Mayor
through
had.
if it doesn't load? Okay.
Or not in Granicus. 219.
The issues, the issues that the PowerPoint covers is really the whole preview of this summer's paving program. We had intended to do it March 17th when the first contract was coming through. Today we've got two items, 2.18 and 2.19. The PowerPoint still represents an overview of that, and I can just walk through it verbally very quickly and hit the points that at least the Vice Mayor was interested in. So as we had prepared and delivered the 2019, this current year's, or last year's pavement program, we heard a lot of very good direction and suggestions from council and mayor on how we might want to implement this year's work, which in regard to trying to get as many possibilities and opportunities for contractors, small contractors in the local area to be able to bid on these projects. So what we did do, oh, there it is right there. So what we did do is reformat our approach to this to actually provide some more opportunities. So last year when we did the 2019 version, we did about 13 different contracts. This year we've got quite a few more than that, and I'll go into that real quick. So just real quickly on the types of projects that we're working on, there's two really types of projects. Preparation projects where we're preparing the streets for surfacing activity, remove and replace, and then concrete ADA curb ramp improvements. Some of these today are fitting into that type of project preparation. And then we have final application projects, which is either the street sealing or street resurfacing. Those are yet to come. This is our pavement pipeline for this upcoming season. It just lays out the contracts we're going to be working on. And the ones, the highlighted one was last week. We've got two today on March 24th, 2.18 and 2.19. So what I'd like to do is just talk about what we're trying to do differently to provide some more opportunity for contractors. One, I did mention earlier that last year we had about 13 different contracts. If you add all these up, and we are going to split one of them up, we've got 22 different contracts we're going to be doing, so quite a few more. Coming up to this for today's are the concrete curb ADA ramps, and then the asphalt concrete remove and replace ceiling prep. What we also did, in addition to these that come to council, if you see under the first one under local and neighborhood streets, the minor concrete and ADA ramps, here's what we did with that. We took quite a bit of the work to do for preparation work and split those into much smaller contracts in the range of $300,000 to $500,000. We've already issued bids and awarded those contracts, and they're already underway. So we've got 8 contractors already in the field for about a month now. And I'll go to the next slide to show you what that looked like. So these smaller contracts have all been awarded to smaller contract firms, trying to achieve that balance of small to large. So these, again, are our local area firms that have received contracts that are smaller in size that they can handle and are underway already, out in the field already. Coming up in the next couple of weeks will be the larger projects that we'll be doing, and those are the later dates in there. Assuming that we're going to still continue to move forward with the program, we'll be coming to council with these other larger projects that are coming forward. So we'll be looking forward to some of the larger ones. Some of the questions that came up were, is it possible for smaller contractors to be bidding on these larger projects? And when we get into the resurfacing and sealing, some of the issues there with those projects are that it requires a lot larger and more expensive equipment. For instance, the paving machinery that we are using can cost upwards of $1 million. So it's just out of the range of some of the smaller contracts. So we think we've reached a balance between small contracts and the big ones where we get economy of scale, and we can handle it with the number of inspectors that we have. So the proposal out there right now gives us a really good balance of small contractors, medium size, and then the large ones that really need to take on the big bulk of the work. That completes my report. Thank you.
Thanks, John. Any questions on that item? Vice Mayor?
Yes.
No. Councilor Esparza?
Yeah, thank you. I actually wanted to make some comments and then ask a question. So I actually wanted to add my voice in agreement with Vice Mayor Jones about the need that our local business community is going to have for these contracts moving forward. And we should not delay more than what we have to. Obviously, we're dealing with COVID. But and my question is around COVID. This money is Measure B money, correct?
So this year is our first year of Measure T.
Oh, T.
So this
Okay,
summer,
that's right.
we're going to be
Last year
using
was Measure B.
$37 million in Measure T to do the resurfacing of a large amount of local roadways, so within the neighborhoods. It also includes Measure B from VTA and SB1 funds. So it's a combination of 3 or 4 different sources of funds.
And so just to, for the sake of transparency, could any of these funds conceivably used for another purpose?
By the vote on Measure T, no. That was pretty clear that it was directed. The other funds that were either state gas tax, it's a constitutional requirement that be used in specifically on roadways like this. And then Measure B, VTA could change the use of those, but it would still likely have to stay within a transportation function.
Okay. And then on the timing of the other contracts moving forward, there's so much that's uncertain right now, but how much of a lag do you see, just given what we know today, how much of a lag do you see in some of these other projects moving forward?
So we've opened quite a few of these already. We have 5 remaining bids to let and then open, but we have actually opened bids and they don't get awarded until they come to council. So it takes about a month between a bid opening to get to council, and then another month after award of council before a contractor would be issued a notice to proceed. So there's at least a 2-month before we open and issue a notice to proceed. So as these come through, there's months between when they would actually start. So I think there's, we're talking into June, July, and August before some of these contractors are actually out in the field.
Okay, thank you. That's it.
I have Councilmember Jimenez and then Councilmember Rennes.
Yeah, thank you. One of the first questions I had is related to just things that are on consent. I know there seemed to have been a presentation, right? I think it was for item 219, right, Jim?
The presentation that you see up there today was actually intended for last week's item that was up there, and we just didn't have time to do it, so it was asked that we would do it today.
Oh, okay. I guess what I was just going to request, to the extent we need to modify anything, is just any item that's on consent, if it has a presentation, if the presentation can be attached to the item I legislate, because I don't think it's on there, and I think
It typically would, but because it was on consent there, it wasn't, so yes.
Yeah. So, good. So the other question I had is this, is that sort of touching a little bit on what Councilmember Esparza mentioned, but with regard to delay, not necessarily in implementing the contracts and such, but actual work. Do we expect any delays? And I know different parts of the workforce are impacted differently, and any delays in getting the folks necessary to conduct some of this work?
Well, so as I said, we have some work already out in the field. What we're doing is our inspectors are actually, they work from home, and then they go directly to their job site, and then they perform those duties with the correct social distancing and other required activities to maintain the right distance for all of the virus issues. So right now we do have work in the field. This would ramp up more of these projects. We are right now looking at whether or not when these bigger projects come through that would require additional effects in neighborhoods, such as moving of cars. So when these go into the neighborhoods, we've got, if you remember last year, we had to ask neighbors to remove cars off the street, and that means a lot of close activities with folks and people having to move and get out of their houses. So we're evaluating whether or not that can be done safely or not. We're also evaluating the safety of both our contractors, our own inspection staff, and just how the processing of these type of contracts fit in with the overall priority of the city with regard to essential services and the contracts that need to be put into that. So we're still assessing all of those things to see if many of these are going to move forward on the same timeline or not.
And then in your experience, do you think it's a practical request from us that are giving out these contracts to request social distancing of some of the contractors? I don't know if that's even possible.
Well, it did not get into the bidding documents for these early ones. It certainly could for the future. We still have future ones, but it's also an overriding state requirement and mandate, so, and a county as well. So it is something that we're practicing and contractors are as well.
Okay.
But it didn't get into any of the earlier contract specifications.
Okay, and the very last question I have is, obviously, you just have to drive out into the streets, freeways, and see that a lot of folks are off the roads. And so what I'm curious about is, if some of this continues, do you expect that some of this work can be done quicker, given that there's less folks on the road and less impediments to clearing?
Yeah, one of the tough things is we have to maintain traffic in a normal time, and we work on that with both police department, secondary units, with trying to make sure that we are safe for both contractors, motorists, and our own employees. With less traffic, that certainly becomes easier. So that would certainly help us in terms of that. I think some of the areas that we're concerned about is when we get into the neighborhoods and have to move a lot of cars.
Yeah, because there will be more cars parked.
That's correct.
In the neighborhoods.
Right.
Okay, all right. Thank you for your work.
Yep.
I appreciate it.
Okay, Councilmember Arenas. See if we can hear you. Not able to hear audio at this time, so I'm going to ask if you can text if you're not able, if you've been trying to speak, Councilmember Arenas, and you're unmuted.
She's coming out of my computer again if you'd like me to put her through the microphone.
Hi, can you hear me?
Yes.
Okay, so I just wanted to thank Vice Mayor for bringing this forward, and I want to acknowledge Department of Transportation. John, you've been really receptive to a lot of our feedback, and I know that we heard this in T&E last month, and you talked about how having these minor projects would render additional business for small contractors, and this is something that you've heard from me over and over in T&E. It's wonderful that it's actually coming together, and it couldn't be at a more appropriate time. Is there any preference for San Jose businesses over outside of the city?
These are all bid for responsive and responsible bidders, and I don't believe that we actually have that I might have to ask a question. I'm not sure if we have a local preference on it or not.
So on low bids, we do not have
Not
a
a low bid.
local or small business preference.
Didn't think so.
Is it too late to add that to this minor projects?
I'll let Ed help me, but at this point, we're not able to introduce those pieces into the bidding environment. We are allowed to do outreach and other measures that we've been doing to ensure that the contracts are sized appropriately and take advantage of the abilities of local workers, but we're not able to specifically introduce a preference for local and small on low bid contracts.
Is that a legal matter, Dave, or is it just because maybe it hadn't been introduced before, or?
It's an issue. When you do local preference, what we did in our procurement is we gave them points, extra points, which we were allowed to do so long as it's not a significant preference with regard to public works. I believe we have been looking at ways of doing that, but unless it's in the bid specs, we can't at this point just add it to the awards.
Actually, I think, Ed, there's a little more. I think right now the charter doesn't allow us to, that all construction contracts must be above $100,000, must be competitively bid. I think we may have changed that up to 600,000, but anything over that needs to be competitively bid, and we're not allowed by charter to have a local or small business preference.
Well, I think we were going to look into that. You're correct. We were going to look and see if we could do that because it only applied to procurements, but we were going to look and see how we could try to do it. But at this point, we can't do it.
You know, this is something that I've also been asking, and like I said, I'm really grateful for your leadership, Vice Mayor. And I know that staff has been hearing me say this over and over again in T&E, and this is breaking down some of these projects so that, one, they can be more efficient, and so that we're not competing against our own selves and creating a higher cost for projects in the end. So I like that these are broken down a little bit more, but for me, I find like it defeats the purpose if we're not giving any preference for our small businesses or local San Jose businesses. And so I would appreciate if we can continue to look into how we can make that possible. Thank you.
And if I could, council members, so yes, I think we're all committed to working through the issues and trying to bring something back to council that would work.
Now we have a couple more speakers. I just want to point out, this is a category of industry that is characterized as essential under the county and the governor's order. So these are businesses that are able to work, and I'm grateful for that. But I just want to make sure we're all sort of on the same page about the fact that these are folks who actually are getting work. Councilman Kemmis?
Well, I have to tell you, I'm very excited about the interest in helping small business. I wish it didn't take this kind of pandemic to spur interest in this. One of the concrete contractors that I've tried to talk into bidding on our projects for many years has suggested that our wage policy needs to be looked at, that it needs to be, not let's put it this way. There's the state wage policy, there's the San Jose's wage policy, living wages, and we have 10,000 pages worth of wage policies that they have to delve through. I think one of the reasons why smaller companies don't apply or at least bid on our contracts, maybe not, is because some of our wage policies are not streamlined enough. And I think if we do, if our interest is truly to get more small companies interested in bidding our process, we have to take a look at what we can do to simplify our wage policies and other policies that make it much tougher and takes a lot longer than just getting, you know, a corporate bid out there. So that's just a word of advice, because I do talk to small contractors all the time that just don't want to wade through our bureaucratic processes, even to get some of these lucrative contracts.
Councilmember Esparza and then Councilmember Perales.
Thank you. So I had a question, a follow-up question on the policy coming back to us. So this is a question for you, John. What would those changes apply to those dates, or are those contracts after these dates?
So if you're referring to, could we change the specifications
For
to allow
these
local
specifically.
preference? So we've already, there are 5 contracts left that we have not yet put on the street for bid. Every one of the other ones have been opened already. They just haven't come to council.
So
there
those
are still
contracts are
5
not in this
remaining.
presentation?
Right, they're
It's-
on this
okay.
list, they're just not today.
Okay.
So those are bids that have been opened but not brought to council yet. So there are 5 remaining, the last 5 have not been bid yet.
Okay. That's it. Did somebody make a motion?
I was about to, but.
Okay. All right. So I'll make the motion to approve it with the guidance that the mayor had brought forward about bringing it back, and the vice mayor, I apologize, bringing that back to us with language about how to change it for the remaining bids.
Councilmember Perales.
Thank you. So I support this effort and conversation and trying to get more small businesses to take advantage of these smaller bids. My comment was a little different in regards to the timing. Councilmember Jimenez brought up potentially the opportunities because we're seeing less cars on the road. I was looking at the upcoming pavement projects for the year. Now, a good number of them are in residential neighborhoods, which obviously we're going to see, I think, more cars parked on the street, as we were saying. But there's some, for instance, Center Road, that may actually see less cars, is what I'm thinking. But I could be wrong. McLaughlin, maybe some other roads that are actually less cars on them today, less cars parked off to the side because those cars are out in the neighborhoods. And then looking out on some, there are other roads like White Road, which was set for 2021. So my interest would be for DOT to take a look at the upcoming pavement projects for this year and the next 2 years, and see if there is actually something where today or for the next coming months there may actually be less cars, less impediments. Maybe we shift around that schedule and try to avoid some of the neighborhood streets if indeed we're seeing that there's an issue there. So just for DOT to take a look at. Thanks.
And I appreciate John's willingness to do this. There are I'm sure many members of the DOT that are being pulled into the EOC right now. And so obviously all this policy work, I know my colleagues will be patient with the fact that we've got people working really hard right now focusing on the very urgent issues of the moment. And so some of this policy work may take a bit longer to work out. Okay. Any final comments? Tony noted that the second was from Councilmember Arenas on this motion. So we're going to first vote on this motion before we move on to other. I'm just reading the text, so Tony can correct me if I'm wrong on it.
Yeah, we heard her over here.
Okay, got it. Okay, so on this motion, we're not yet considering all of consent, just this item. Tony?
Jimenez?
Yes.
Perales?
Yes.
Dieppe? He said yes. Davis?
Councilmember Davis?
Yes.
Got it?
That was yes if you didn't hear her. Esparza?
Yes.
Arenas?
Aye.
Foley? Aye. She said aye. Camus?
Yes.
Crosco?
Yes.
Vice Mayor Jones?
Aye.
Mayor Liccardo?
Aye.
Thank you.
Okay, item 2.22, I believe, was pulled by Councilmember Esparza.
Yes. So I had a question about this item on both. So I had a couple of questions. One on the original memo, and so I think my question would be to the city clerk or to the city manager, but I'm going to look at you because I think you're the one, Tony. I know you're multitasking like crazy right now. So on the original memo on page 3, I had a question about in the first paragraph, so that last section of the first paragraph, which says, without requiring a quorum of the members of the local body to participate from locations within the city's jurisdiction. So my question was, so for example, could the planning commission hold a meeting with 2 members? Am I reading that correctly?
Okay, the Brown Act previously said you can only teleconference in. Members can only participate if there was a quorum present within the city limits. So we're just saying that if you have 2 members in San Jose and 2 members in Alameda, you can establish a quorum outside of the city limits because that's what the executive order came out.
Okay. But
there's a lot of restrictions
quorum
before.
is still required, right?
Yes, a quorum
Correct.
is still required. They just don't all have to be within the jurisdiction limits.
Cool. And then I had a question around the supplemental memo. The last sentence of the first paragraph that says, documents such as staff reports, ordinances, and resolutions would not need to be posted 72 hours in advance of the meeting. Is that specifically related to COVID, or all documents not be posted within 72 hours of a meeting?
I don't
Should I
think
be
we're.
looking at the
I
city
didn't-
manager? or
So
the-
that was a proposal. Clearly, the council doesn't have to accept that. Under the Brown Act, even under the old Brown Act, before the executive order, the only thing that has to be posted is the item on the agenda, what the council is going to speak about. It doesn't require the posting of any documents prior to the actual meeting. The city council, back with the mayor, Chuck Reed, decided that they would supplement the Brown Act by creating the Sunshine Policy, which required the council to post documents 10 days before the actual council meeting. So the council itself decided to impose additional procedural requirements. The governor has now decided that they need to be more flexible in how they deal with public meetings. And so the proposal is to go back to the original intent of the Brown Act, which is basically you have to post an agenda item 72 hours before the actual meeting so that the public is aware of what the discussion is. The Brown Act itself does not require the posting of documents at any time. So this basically allows the city staff to rely on the way the Brown Act was originally and not require the posting of documents with any period of time so that they can finish up the documents necessary to get items on the agenda.
Yeah, I don't think Ralph Brown would have anticipated the internet or some of the posting that we do nowadays. So my question then is for the city manager. I'm not inclined to sort of approve sort of a blanket statement without any guardrails. I appreciate, the enormous work and complications that this brings up, as we can see here today. But what I'm looking for is a little bit more of a guardrail on that statement. Can you be
I'm
more
gonna jump
specific?
in at this point. I think this is an important matter to consider. But we've got 2 heads of the Emergency Operations Center and a police chief that have been waiting and have to speak on this very first item and get back to work right away. And I think it's important that we hear from them. And then we're going to come back and take up, and I think going forward, we're not going to have consent items before 3.1, because I can't afford to have EOC heads and chief of police at a time like this sitting here while we're talking about pavement or anything else. And so what I'd like to do with everybody's patience is I'd like to jump to item 3.1 so we can get to that right away. And then from now on, what we're going to do is we're going to take up consent and all these items after we have a report from the Emergency Operations Center and key folks about the crisis we're currently facing. And I'm not in any way diminishing the importance of these items, but I think you all recognize the time constraints that many of our folks are under right now. So with everyone's permission, I'd like to jump ahead to 3.1, and then we'll come right back to Councilmember Esparza's question.
Okay, thank you, Mayor. So we've got quite a bit planned here under 3.1. Certainly appreciate the opportunity to provide this update. It was a week and a day ago that we went into level 5 and the county issued the health order that we are now working through implementation. So a week and a day ago. We've made significant shift in the organization in that time frame that we're going to share that information with you. I want to acknowledge the challenges we're having with technology here, and hopefully at our next meeting, which is in 2 weeks, we're able to overcome those challenges so that everyone can feel like we're conducting a productive meeting. Want to start off a little bit with the roadmap that we've been working on. And in essence, the 4 main priorities of our roadmap. The first is compliance with public health orders. And we'll have Eddie and others talk a little bit more about that in a minute. Our second is essential services and continuing all essential city operations. And I'll talk a little bit more about that in a minute. Third is support for at-risk populations, and we'll have Lee and Jim and Angel provide details on that. And then fourth is support for our people so they can act. Starting with the essential services, wanted just to acknowledge the fact that we have a lot of essential services functioning at this time, as you've heard me talk about, and I think you all are aware. That's more than just police and fire. And really our priorities are to the community that we are able to maintain at all times all public safety services, all essential city facilities and utility and infrastructure services, wastewater, garbage, energy procurement, and as we just talked about, our work on our roadways. I also want to acknowledge the fact that there's a lot of strategic support functions that are currently being maintained to support all of our work in terms of serving the community. And so certainly the operations in the EOC, our finance department with payroll and purchasing and accounts payable functions, investment monitoring, human resources, employee safety, workers' compensation and benefit services, information technology, network and server operations, cybersecurity, laptop and desktop support, and 311 services all is continuing with public works, fleet and facilities maintenance, and custodial services throughout the city. City Attorney's Office, contract, litigation, and other legal services, and City Clerk's Office with regard to the City Council meeting and contract execution support. When it comes to our employees and keeping our employees safe, we have put in place safety protocols to ensure that our workers are safe, both in terms of coming to work and in terms of performing their work. We have secured priority testing for not only our first responders, but our essential service workers, so that we have access to priority testing when employees are symptomatic. I also want to acknowledge that we do have employees that have tested positive, and so we have protocols in place to not only test, as I just mentioned, but to ensure that we're able to make sure that their coworkers and the public are safe. I know my microphone's having some problems, but
We're getting you a new one.
okay. Thank you. Thank you. So the safety of the public, safety of our employees is most important to us. I'm going to now I think I'm kicking it off to Kip. And as I mentioned, we'll get into support for our at-risk populations and also how we're seeing this play out for our city and our county. Kip?
Thank you. Kip Harkness, Deputy City Manager. I want to take a moment to walk through a little bit of what we're seeing coming with the COVID-19, what we know from our modeling, and what we think that means. And then we'll walk that through how we've organized our roadmap again, how we organize the entire structure of the Emergency Operations Center, and then do a deep dive into a couple of key topics, notably feeding and homeless support as both in priority topics and also an illustration of how we're organized. So the way they describe it in training is the role of the EOC director is to be the thinker anticipating the needs in the field. To fulfill that role, we are using data modeling to understand the spread and shape of the COVID-19 epidemic in Santa Clara County. Now, the data I'm about to present is a rough estimate. The county is working on a much more detailed and robust estimate, but given the urgency of the situation, we have decided to share this preliminary results with you and the public today in order to drive the action that is needed to save lives. So again, there'll be a range here. This is not a crystal ball predicting the future. And again, the actions we take can very much influence this data. But I want to walk through some preliminary modeling we've done based on the best publicly available models and the best publicly available data led by our futures group, led by our data analytics lead. So first of all, starting out with the confirmed cases and related hospital visits. Both of those, as you know, are rising on a daily basis. That rise does fit an exponential curve, but you can also see that our ability to test is falling even behind that curve. More importantly, our ability to test has been very constrained by the number of tests that we've had and our testing capacity, and we know that it represents only a small fraction of the actual cases that are out there. So our initial estimate, when we run the numbers, going back to the first cases that we know and what we know about them, and then run the curve from those first numbers based on some pretty conservative assumptions about transmission, are that we get a much, much higher number than the 300 some that you're seeing here. So you see three curves. The top curve is the worst case scenario with no mitigations or no changes, everybody going about their business. The middle curve is we've got some mitigations in place, but people aren't really following them. They're still mostly going about their business. And then the bottom curve is we've got those mitigations in place, and people are mostly following them. We've allowed a gradual lag in as these have been introduced. Bottom line, if you look down in the far right, at the bottom right, you can see a little tiny dots down there in red and black. That's actually the last graph that I just showed you. So all this information here is down in that little tiny bit at the bottom right. It's so small you can't even see it on the scale. So our testing doesn't even show up versus the actual case. Our estimate is then that there are between 9,000 and 19,000 actual cases in Santa Clara County right now today. So what's happening next? That's pretty important. There's, again, three different scenarios here. The large, big curve on top is nobody changes their behavior at all. The middle curve is they change their behavior a bit, but they're not really complying. And the smallest curve, in kind of the lightest color, you see is if we have strict compliance and enforcement of the public health orders. The black bars that you see are some estimates of our ICU capacity, our intensive care capacity. Again, the county will be doing much more detailed modeling on this, but this gives you a sense of what happens. What's important to this, remember last time we spoke that 80% of the cases are mild, about 20% of them are severe and critical, but it's really those critical cases that are going to require ICUs and ventilators which are the most important. Without ICUs or ventilators, those critical cases, the death rate in those doubles. And so what we need to do is make sure that everybody who's critical has an ICU and a ventilator. And so we need to keep the number of cases below the number of ICUs and ventilators we have, and surge the amount of ICUs and ventilators we have to try to raise up to the number of cases. As you can see, the public health orders significantly flatten the curve in terms of the demand for ICU units needed. And if we surge, we might just be in the place where we're close enough to meet that demand. Third piece is the hardest slide to look at, and it's predicted deaths. Again, same three scenarios. The first one, we do nothing. Second one, we do something but not well complied with. And the last one, we follow those public health directives and orders very well and comply with them. You can see even in that best case scenario, we were looking at the order in the next 12 weeks of 2,000 potential deaths directly from COVID-19. So our preliminary data of the epidemic allows us to see patterns of what is to come, and that pattern is going to be long and hard. An examination of this pattern derives three key insights that I want to walk through. First key insight is there is widespread infection in the county now. The current number of 375 positive tests vastly undercounts the number of actual cases. As I said, our model suggests that could be 25 times higher or more than the number of reported cases. So that means we have a false sense of security in terms of thinking, oh, everybody who's tested are the only ones who are affected. No, there are a large number of us walking around who are infected. Second insight is we have one opportunity to bend the curve of this epidemic, and that opportunity is now. The good news is the public health measures put into place by both the state and the county, limiting travel, gatherings, businesses, closing of schools, requiring us to shelter in place, and socially distance, together, if complied with, will significantly bend the curve. This may be enough that if we dramatically surge our healthcare capacity, we can meet the needs of the most critical patients. This, again, is the best case, and even there, we are likely to see many, many hundreds or up to 2,000 deaths. Final insight from the patterns is the next 3 weeks are critical. Even with full compliance, we are looking at a high and to the right exponential growth of the epidemic, and then that will continue for the next 3 weeks, even if we are successful in compliance with all the public health orders. So within the next 3 weeks, we need to, as we hit the peak, assuming we do our job right, we will be seeing the maximum strain starting to hit the healthcare system and a maximum number of those who are sick and infected at their sickest. That means all of the capabilities and capacities that we are putting in place need to be able to be up and running at full scale within 6 months. So from these insights, we can begin to drive the actions that will do the most to bend the curve and protect our most at risk. What actions are those? Those actions at a high level are embodied in our roadmap in priority order. Our prime directive overall is to slow and reduce the spread of COVID-19 and support our most at-risk people. So that comes into 4 main categories that the city manager talked about. Number one, and the most important thing that everybody can do, is compliance with the public health orders, shelter in place. This is this weird moment where the biggest thing you can do to help this is do nothing. Go home, stay on your couch, watch some Netflix. I know it's hard, especially for those of us who think action is the thing that we need to do, but in this particular epidemic, being may be more important than doing for most of us. Second piece is essential services, and the city manager talked about that. Third piece is support for at-risk, and the at-risk in this case is specifically the at-risk for this disease and the effects it will have. So we start with seniors and medically vulnerable. We include also homeless. We look for housing for those who are quarantined in isolation. And then the second wave of effects of economics on individuals, families, small businesses, and nonprofits. And we're actively ramping up teams and work in all of those areas. We'll talk about that more in a bit. In the last week, we essentially have entirely reorganized the management and service delivery system of the entire city in 2 important ways. One, we've shifted from normal provisions of a wide range of services to just essential services and essential services provided through the lens of COVID-19, with attention to safety of the staff and community. 2, we've shifted to new and enhanced services related to compliance with the orders and supporting the at-risk population, such as feeding and homeless sheltering, that are way beyond our normal operations, and in the case of feeding, way beyond our normal mandate as it expands to include the entire county. The structure of the Emergency Operations Center, which you'll hear Lee talk about more in a moment, is now up to 220 people who are part of it and 100% focused on implementing this roadmap. We must bend the curve now to avert the worst of this epidemic. The reorganization that we've done in the EOC has followed Jim Collins' advice in Good to Great and focused on putting together the right people in the right teams and giving them a high level of autonomy, getting the right people on the bus in the right seats and pointed in the right direction. As we formed those teams, we are asking them to do three things. Focus on the vital few actions. We are not able to do everything we would like. We have to pick a short and powerful list of those actions that will bend the curve most or protect those most at risk. Act fast. Within 3 weeks, we will be deep into dealing with the impacts, and we have only a narrow window to act. With the exponential growth of the epidemic, acting fast is more important than acting perfectly. And finally, scale the team for the long haul. Right now, we're in a sprint. Ultimately, this is a multi-sport endurance event. And so we're going to need the team that's going to be able to do all the different long-haul things and sustain this. This is not something we can stop after a week or 2 or 3 or 4 or 5 or maybe even 12. So Lee will talk more now in detail about how we've organized the EOC, and then we will take a look at some of the examples of our action approach in both feeding and homeless response. Lee?
Thank you, Kip. Can you go to next slide? Next slide. Thank you. So as Kip mentioned, a great deal of the organization and folks in the EOC, while we've been implementing over the past few weeks, a larger team of us have been focused on this roadmap and the importance of it. Usually some of these roadmap exercises for us lead to higher level objectives that the EOC would be pointed to, but it is very important for Kip, myself, as well as our operations chief, Angel, and Jim, that we operationalize these within the EOC and that we make very specific, measurable progress over the coming days. So what we've been able to do over the weekend is really take these roadmap items and work streams and put them in the operations center. So now we have teams as we move forward that are focused on these specific items versus one department focusing on just their part. So an example within the management section that Kip and I co-lead, the first one, the compliance branch, which is really compliance with the county's public health order. That's a team made up of folks from the city manager's office, PD, as well as EPIO. So these are interdepartmental teams that are focused solely on one mission. Same with under the personnel branch, the safety of our first responders and our workforce that are responding to this. That's a work stream within a roadmap that we've brought into the Emergency Operations Center to focus on. And Jim will focus on a few of those when we cover operations as well. But that's a different tactic for us to do, and one we believe, given our circumstances, that is necessary. The second thing is, as we had talked to you about in our study session, Emergency Operations Centers, we typically take a plan off the shelf once a disaster is hit, and then we can solely focus on responding to this disaster. As Kip has illustrated to you today, this disaster is still continuing. It's evolving and changing. So our ability and our need to plan while we implement is greater than it's ever been. So we've done a few different things, really 3 things, to augment our approach during this period. The first is we've added capacity to our planning section, which is really important, focused on our weekly goals, as well as we've stood up and you can see it in this slide, a future planning branch. And this is something new that we're going to start, is to really ensure that we keep those folks that are focused on those work streams and roadmap work streams on the actual problem. They can be focused on a few small actions, acting quickly, experimenting with them, and then quickly scaling them up so we can respond, while another set of people can focus on what's important in week 2, what's important in week 6. And similarly, with some of the larger problems that you'll see, or the larger work streams that are really complex and that we need to figure out immediately within the next 3 weeks, as Jim highlights, you'll see different planning or future groups embedded in some of those different work streams or roadmap exercises, so that we have folks dedicated to focusing and implementing on what's happening this week and the following week, while another set of people in the organization can do that long-term planning. With that, I'll hand it over to Jim to focus on operations and the changes made there.